All right, so I believe that we are recording it. Let me just double check that that's the case. Okay, and now I'm gonna, forgive me, I'm going to mute everybody. Okay, so I got started with natural health back in 1999, and I was chronic fatigue, chronic headaches, and I had that for as long as I can remember. I was lethargic as when I was in grade school, and it wasn't until I was 29 and I started catching a cold every 8 weeks. It would last for 3 weeks. I'd get well for 5 weeks, and then the whole cycle would start over. And that went on for a year. So I finally got tested, and they came back and said everything looks great. And it was at that point that I began to tinker with my diet. I eliminated white refined sugar, white flour, and then I started working with a naturopath. And at the end of that cleanse and that year of changing my diet, all of those symptoms were reversed. And I had more energy than I could ever remember having. And then we had an incident with a couple of my kids and also my wife in just reversing conditions, eliminating symptoms that people said were non-reversible. So those included eczema covering 80% of your body, allergies, Hashimoto's, and some major autoimmune stomach issues. So that got me looking this direction. The first person I ever heard or read that talked about thermography was Dr. Mercola. And this was at about 2006, and I just kept studying it, and I eventually came to the point where I thought we need to bring this to Louisville. So we did. And about 3 years after that, I started my school as a naturopath. I really just wanted to have a little more weight behind some of the things that we were teaching women about lowering their risk for cancer, for breast cancer. So, but I went to Trinity School of Natural Health, and I ended up liking it so much that I was like, well, I'm going to open a practice for that too. So that's kind of how that went. And what I'm going to show you tonight is two sides to breast cancer detection. And I'm going to begin with mammography because it's right smack dab in the middle of Breast Cancer Awareness Month. Most people know what that is. That's when all the NFL football players are wearing pink. But the message that goes out for Breast Cancer Awareness Month is early detection through mammograms is your best protection. So I'm going to just discuss that conventional wisdom here. But before I do, I just want to say, one of the things we get as feedback from our clients is there are a lot of women that will go to their gynecologist, OBGYN, and they will say that they want to do thermography, and the whether it's a nurse practitioner, gynecologist, they get this message that thermography has been disproven, that there's no studies that show it's effective, and so a lot of the times, depending on what these women have learned, I mean, some women are just like, yeah, right, or other women are like, well, okay, if the doctor says it, it must be true. So I'm going to kind of start there. And what I want to say is everything that they're saying about thermography is being said about mammography as well. And that's not just coming from naturopathic doctors, it's coming from medical doctors who are questioning the wisdom of doing routine screening using mammography. So with that as a background, I'm going to go ahead and jump into this. In 1995, the National Cancer Institute stated that breast cancer is simply not a preventable disease. The American Cancer Society followed suit in 1997, saying there are no practical ways to prevent breast cancer, only early detection. So that's the message that's going out is, ladies, there's nothing you can do, just get your mammogram. That's the bottom, that's conventional wisdom. Well, I want to ask you a question. What does early detection mean to you? Would that be 8 to 10 weeks that a cancer's been growing before it's able to be detected? 8 to 10 months? Or 8 to 10 years? This is from the Journal of Surgical Oncology, 1997. Mammography can only detect cancer once the tumor has developed to a measurable size. A breast cancer growth has 4 to 10 billion cells before a mammogram can detect it. So, question, how long does it take to get to 4 to 10 billion cells? 8 years. Is that, in your opinion, is that early detection? Most women say no. They're thinking more 8 to 10 weeks or 8 to 10 months, not 8 years. A cancer has been growing. So we're using a technology that guarantees you have an advanced cancer before it's detected. So I'm not trying to be too sensational here, but again, this is fair. This is not from Naturopathy magazine. These are from the conventional medical journals. So right there at the 4-year mark there are studies that have shown that thermography will pick something up as early as that point. So how valuable is that for a woman to have a 4 to 5 year advanced lead time before something gets to 4 billion cells? That's pretty significant. Now, I do want to say before I will be getting to a thermography portion of this. Thermography is not perfect. It maybe is about 85% detection rate is what we're finding. So it's about, it is effective, but it's not perfect. But there are other advantages, even if it doesn't detect, and I'll go into that in just a second. So I want to ask the question, why is there silence on prevention? Well, here's one reason for the silence, especially during National Breast Cancer Awareness Month. There exists a decade-old multi-million-dollar deal between National Breast Cancer Awareness Month sponsors and Imperial Chemical Industries that has produced reckless misinformation on breast cancer. So who is ICI, Industrial Chemical Industries? Zeneca ICI produces acetochlor. This is the company that created National Breast Cancer Awareness Month and controls all the information about it. They produce acetochlor and vinyl chloride that are both known to cause breast cancer. They manufacture the most popular breast cancer drug in the world, tamoxifen. Can you say conflict of interest? They're not interested in prevention at all. They're interested in treatment. Tamoxifen, by the way, is listed on the International Agency for Research on Cancer as a carcinogen causing ovarian, liver, and cervical cancer. So you out of the frying pan and into the fire. Financial sponsorship by Zeneca ICI gives them editorial control over every leaflet, poster, publication, and commercial produced by National Breast Cancer Awareness Month. This campaign, this is Dr. Epstein. This campaign has prevented women from knowing of avoidable causes of breast cancer. 80% of the women who have breast cancer have no known family history. So a lot of women feel like, well, if their mother had it or their aunt had it, but the reality is 80% of the women have no family history. In fact, less than 5% of women who had breast cancer had any genetic predisposition at all. So there's something more going on than just bad genes. So again, not trying to be too alarmist, but just a little background on the mammography industry. So rather than focus on Breast Cancer Awareness Month, I suggest we focus on Breast Health Awareness Month. Some of you may have seen there's a documentary series. It's very well done. It's 9 parts by Ty Bollinger called The Truth About Cancer. This lady was featured on there. In fact, we carry her books, 7 Essential Steps to Beating Breast Cancer, Dr. Veronique Desaulniers. According to the book, she cured herself of cancer, breast cancer, twice. And now she coaches other women on what she did. She's helped probably close to 6,000 women at this point. So is there more that we can do than just wait? I would suggest if you read that book, the answer would be yes. Friend of mine, Maureen Simon, had stage 4 uterine cancer. That was about 10 years ago. She was given 2 months to live. She did not do chemosurgery or radiation. She's still alive today. So, not going to go into all of that, but one of Dr. V's 7 essential steps is early detection with thermography. So that's a pretty good endorsement, in my opinion. This came out in the New York Times on February 11th in 2014. This was a quote from, they were quoting the British Medical Journal. One of the largest and most meticulous studies of mammography ever done, involving 90,000 women, followed over 25 years, found that the death rates from breast cancer and from all causes were the same in women who got mammograms and those who did not. So let that sink in. No difference in the death rate between women that were screened and women who were not. However, the screening had harms. 1 in 5 cancers found with mammography and treated was not a threat to the woman's health. You're not going to hear that on mainstream media, that there are types of breast cancer that will never become a problem. They're encapsulated, they're walled off. Of course, if you go poking it with a needle, it's going to spread. But that was not a threat to the woman's health. It did not need treatment such as chemotherapy, surgery, or radiation. Again, this is not Tree Hugger magazine. This is New York Times, February 11th, quoting the British Medical Journal. This is a medical doctor quote. Our current estimate is that about 75% of the current annual incidence of breast cancer in the U.S. is being caused by earlier ionizing radiation, of which mammography would be one source of that, primarily from medical sources. 75%. Mammograms require very small doses of radiation. Again, you'll notice the caption at the bottom. This is conventional wisdom, National Cancer Institute website. This is, I'm just showing between this slide and the next one that you're going to get 2 very different pictures. Mammograms require very small doses of radiation. The risk of harm from this radiation exposure is extremely low, but repeated x-rays have the potential to cause cancer. The benefits of mammography, however, nearly always outweigh the potential harm from the radiation exposure. And that's the complete opposite of what was just said in the New York Times article. What's more, this is from an article called Danger and Unreliability of Mammography. Let me see. That's not a, let's see. This is what he says. He says radiation from routine mammography poses significant cumulative risk of initiating and promoting breast cancer. Contrary to conventional assurances, like the one I just showed you from that website, that radiation exposure from mammography is trivial and similar to that from a chest x-ray or spending 1 week in Denver, about 1/1000th of a rad. The routine practice of taking 4 films for each breast results in some, listen to this, 1,000-fold greater exposure. 1 rad focused on each breast rather than the entire chest. I'm quoting people, again, I'm not pulling this stuff out of my hat. Thus, premenopausal women undergoing annual screening over a 10-year period are exposed to a total of about 10 rads for each breast. As emphasized some 3 decades ago, the premenopausal breast is highly sensitive to radiation. Each rad of exposure increasing breast cancer risk by 1%, resulting in a cumulative 10% increased risk over 10 years of premenopausal screening, usually from ages 40 to 50. And by the way, people with the so-called the BRCA gene, the breast cancer gene, are even more susceptible to radiation, more sensitive to it. And about what age are those women getting mammograms? They're starting in their 20s. So it's almost assures they're going to get breast cancer. So enough about that. Let me tell you a little bit about thermography. So let's get into this a little bit. So here's some highlights. It's safe, it's easy, it's pain-free. Nothing's going to smash your breast. There's no radiation exposure. It is the earliest way to image breast health issues. It provides a picture of overall inflammation, which we'll see. It is, in my opinion, the very best imaging for the lymphatic system. Well, okay, that's my next point. It's useful for evaluating the chest wall after surgery, so women that have had a mastectomy. It's effective for men and women. We do work with medical doctors. So again, if the medical doctor says these don't work, I would ask him, why then are radiologists interpreting these things? Because they are. All right, so I want to just show you one study that's out there. Spitalier and Associates used thermography to screen 61,000 women over a 10-year period. They found that 91% of non-palpable, that means you can't feel it, cancers, were detected by infrared imaging, and that of all the patients with cancer, thermography was the first indicator of the disease in 60% of the cases. Pretty good study. So these are your Halloween pictures. The one that is, can you guys see the little cursor moving? Okay, so this is a normal image. Draw a line down the center of your body, and the right side should look the same as the left side. They should be symmetrical. So when you jump over to this other picture, you can see that there is a health issue going on in the left breast. It is that honeycomb pattern that you see is indicative of fibrocystic breast disease, which comes with a higher risk for breast cancer. So that would be one way that thermography looks for breast cancer. This is male, the image here on the left. This is showing blood vessel formation that is entering this area here where the yellow is surrounded by the red. That's a tumor. And then you have blood vessels exiting. Whenever you start to get that blood vessel, that's where you really start to get the rapid growth. And this is a DCIS. So again, what you're seeing is asymmetry. This is inflammatory breast cancer, which is not detectable by a mammogram. We actually have seen a couple of clients with this. But as you can see from that image, I mean, it lives up to its name. It creates inflammation. It spreads like a sheet across the breast. and it shows up very well for thermography. So that red that you're seeing below the armpit here, none of that should be there. So we have some significant lymphatic inflammation here. So those of you with some naturopathic training or knowledge about the lymphatic system, you have two major fluid systems in the body, the blood and the lymph system. And the blood makes up about 25%. The other 75% is your lymphatic system. It is responsible, at least in part, for being the sewage system of the body. So it's removing cellular waste and toxins. If you have a backup in that type of inflammation surrounding your breast tissue, is that a good situation? No, it's not. Now, this woman was using antiperspirants and applying it 3 times a day. You do not want to use antiperspirants. It's bad for your breast health. Whether or not the aluminum gets in there or not, that's the armpits are a major avenue for dumping toxins, the sweat coming out of there. So the lymph primarily gets out through the urine and through the skin. So you don't want to clog your pores. Dental health. There is a high percentage of breast cancers where someone has a root canal on the right side, the breast cancer is on the right side. So there, you will find doctors that will tell you that there is an ironclad link between root canal teeth and breast cancers. So again, a lot of this stuff is subclinical. It's not visible to the naked eye. You run a X-ray through the mouth, it will not show this. But what you're seeing is inflammation in the mouth with drainage coming down from the mouth into the lymphatic system. Is that valuable information? Absolutely. That's stuff that you can go in and say, okay, I know I've got toxins coming down. Let's do some things to fix that. This picture on the left, lots of inflammation. That this picture on the right, same person where it has cleared up. Anybody want to take a guess? These two pictures were taken 10 days apart. So some of you that have seen this might remember that this woman was drinking 8 to 10 diet sodas a day. Look at what that's doing. So aspartame is not a health food. Low thyroid can be visualized. That blue over the heart area here, showing coronary artery disease. We actually, one of our clients in Evansville, she did, kind of at the last minute, decided to do the upper body. It showed inflammation in the carotid artery. She had it checked with ultrasound, and there was a 90% blockage. So she credits that thermogram with saving her life. That blue over T2, immune system dysfunction, excellent for monitoring arthritis. And I'll just throw this in real quickly. This is an excellent tool for monitoring the benefits of something like CBD oil. You may not see, you might not feel something, but if you take an image 30 days after starting and you take the CBD oil every day, you should notice a difference in the inflammation in your body. A lot of people are getting help with arthritis. We had a man in Owensboro that came in, did a full body thermogram. This showed up in one of his legs. There was no outside visible sign of this. Diabetes, you start to see the hands really hot like this. TMJ. I'm not going to go into a whole lot on prevention. I wanted to mainly cover thermography, but from a naturopathic perspective, and I have seen these in my own life, and in my practice, there are only two things that can heal cancer, and I have seen both: God and your own body. So when we give the body what it needs, the proper nutrition, and we remove what it doesn't need, toxins, the body is quite frequently able to repair itself. So from a naturopathic perspective, I've tried to summarize 5 primary causes of disease. One is starvation, meaning we're eating foods that don't have nutrition in them. So processed dead foods, and even foods grown in soil that just doesn't have the mineral in it. Intoxication, which would be a buildup of toxins in the system. Constipation, a backup in the colon and failure to eliminate toxic waste. Dehydration, insufficient water. Separation, no peace with God, self, or others. And by the way, hundreds and hundreds of people are getting healed just by dealing with number 5. It would be easy to look at that and say that's the least important one, but actually I feel like it's probably the most important one. So I'm going to go ahead and stop there. There's a lot of different things that we're doing to poison ourselves. Susan G. Komen's really big during Breast Cancer Awareness Month. Look at that top one. 47 drugs cause breast cancer. One drug increases risk by 1,500%. It's a cholesterol lowering drug. So again, if we could figure out natural ways to deal with those things, probably a better idea. Okay, so I'm going to go ahead and unmute everyone. And then if you have some questions, some of you are still muted, but I've unmuted you on my end. So what questions do you have for me, if any?
And I just want to see did Aubrey get on here?
Yes.
Okay. Hi, Aubrey.
I think Aubrey is still muted. But I did see her name on there.
Hey, I'm sorry. Here I am.
Okay.
Hi, you.
Hey.
Okay. I had a question, Chip.
Sure.
When you use thermography for a variety of things, like you saw that lymphatic issue, how soon, like, you can use it actually as a way to keep a tab on progress, right?
Correct. Yes.
And so there's no problem with shooting thermography images over and over, is there? Just like you can't get, we shouldn't have multiple mammograms, if we have mammograms, but there's no problem because it's infrared
it is
technology.
Right. It's detecting what's coming off of your body. So you can do thermography every day. It's not going to hurt your health at all. It's just no different than getting your picture taken, just that this is a highly sensitive camera that will detect temperature differences in the body to hundredths of a degree.
Gotcha.
So that's the difference. Yeah. What other questions? Any questions? Other questions that you have?
So generally, would you recommend a yearly full body screen, or I mean, I'm sure it's probably going to be client dependent, but just somebody who's just coming in, do you recommend a full body screen, or are you going to go, by symptomology if they're having issues here or there?
I think a periodic full body is helpful. So for somebody that really is not having symptoms or isn't trying to monitor or something, doing that maybe once every 5 years, something like that, is probably beneficial. But we do recommend doing the breast every year. So, you might do the breast 4 years in a row, and then the 5th year you do another full body, something like that.
Okay.
Yeah. and it's also helpful. You know, we try to educate women on some different ways to improve, for example, the lymphatic system. So rebounding or dry brushing, you know, obviously making some corrections with the diet and things like that, changing deodorant. I know Laurel recommends a clothing line called Ruby Ribbon, where they basically eliminate the bra, they eliminate underwire. Those are all things, you know, the bra straps cut into your lymphatic system, and you see that on the thermogram. So over time, it's nice to be able to monitor, well, are these things helping? And, you know, for some of the women, we had one lady that came in, she was miserable. Her breasts were so tender, it was painful to wear clothing. And she took this little booklet that we gave her. She did everything in it. 3 months later, she came back in. That thing looked like it had been through the washing machine. It had been used so much. And but she had completely reversed that tenderness. And we had a very happy client.
Wonderful.
Awesome.
So as far as frequency of getting the scan, if you do have a history, I have a history with melanoma. So I was advised that it's not beneficial to get it any sooner than just once every 6 months. Do you feel like that's true, or do you think it's, I mean, what's your opinion on that?
Well, I mean, if we do have, like, what I have had some clients. I do have one active client that comes in every 3 months because she has an active breast cancer, and she wants to monitor it. I had another client as well that had breast cancer and was treating it naturally and was using thermography to monitor her progress, and she got it to go away. So if there's an active cancer, doing it more frequently is certainly helpful. If it's just a screening and there's no evidence that there is something, I mean, doing it more than yearly is really not recommended.
Okay. That's good to know, because I'm new to this, but it was recommended to me because I'm trying to stay away from, you know, those nasty PET scans.
Right. Yeah.
So I'm new to the whole thermography world, but I love it so far.
Yeah. Yeah.
So.
Yeah. Very good.
I have a question. How much of, or what parts of the body does the half body scan cover?
So the half body will cover the abdomen, the breasts, and the head and neck. And then the full body will add in the legs and the feet and the arms and hands.
Okay.
Yeah.
Another question then is, like, how could we get our insurances to help take care of the cost?
Yeah.
Is somebody working on that, or?
Gosh, I think it just depends on state to state. I mean, I don't know if anybody's working on it in Kentucky or Indiana, but you can go to there's a website, ubcf.org, United Breast Cancer Foundation. So it's ubcf.org. And you can apply to get a scholarship. They'll pay up to $150 towards a thermogram.
Oh, wow.
And a number of women have done that. So the ladies come in, they just pay us, and then they get reimbursed from UBCF.
UBCF, okay.
Yeah. And then beyond that, you know, we when clients ask us about insurance, you can give us a call. We'll give you, you know, there are some codes that people use. If they don't cover thermography, they may cover the risk assessment, which is what these doctors are doing, looking at the history, and they ask very specific questions that are known to be related to breast cancer risk. They combine that with what your imaging looks like, and they give you an overall risk assessment. So that is something that you might successfully get covered.
And Dr. Chip, I just want to add in here that some people have an add-on insurance, a gap insurance called Aflac. You know, the one with the good Aflac. The dog. They tend to cover sometimes $50 or more of an annual thermography. So we actually had access to that one year, and I didn't know it. So now I don't have that anymore. But yeah, so there's, you know, I think there's probably much more attention to things like thermography, maybe on the East Coast, you know, than certainly in flyover country.
Right. Yes, in California, it's pretty common there as well.
Mm-hmm.
It's getting there. I mean, there's a lot of it. There's more breast thermography centers opening all the time.
So
yeah, go ahead. No, go ahead, Aubrey.
Okay, so what would, you know, I'm in Oklahoma, and I don't know much about thermography at all. This is very interesting. So what would one expect to pay kind of in this Midwestern area for a half body scan, a full body scan, just to get a rough estimate?
What part of Oklahoma are you in?
I'm about 100 miles from Oklahoma City. That would probably be the closest place to go.
Because we do thermography in Oklahoma.
Really?
Yeah.
Where are you at? Are you in Tulsa? Or?
Well, my daughter's in Tulsa, and that's the pull to go there.
There you go.
Too, so now we want to go there even more.
Okay.
But no, we go. A friend of mine, Sherry Rapp, does this in Enid.
Okay. Yes.
So that we've gone to Enid. There's a chiropractor in Tulsa, and his wife's a medical doctor. They have a really neat practice there, and I was going to approach them about doing it there.
Okay.
So I don't know if you're close to either of those two cities, but
I'm closer to Enid. I'm in far western Oklahoma.
Okay.
Almost into the Texas Panhandle, so I'm in kind of the middle of nowhere.
Yeah, I gotcha. Well, you know, we have been to, I think, three years in a row. We've been to Tulsa.
Okay.
And you know, I might talk with her about doing it twice a year now because I want to see my grandbaby.
Sure.
So, but yeah, we charge $195 for the breast, $295 for a half body, and $395 for the full body.
Okay.
Yeah.
Hey, that's a lot cheaper than a CAT scan or a PET scan, or
Right.
without all the toxins and the exposure.
Right. And one thing I would throw out is that you know, for our insurance, we use a ministry called Samaritan Ministries.
Mm-hmm.
I don't know if you've ever heard of that, but if you ever have any clients, especially as a naturopath, they will cover naturopathy, and they may cover the thermography as well. But just something to keep in mind.
Is that like a cost sharing, sort of like MediShare or Christian Health?
Yeah, it's just like MediShare. Yeah.
Okay, cool. So, and tell me that name again, Samaritans?
Samaritan Ministries. Started by Franklin Graham.
Oh, yeah.
They were supportive of naturopathy. That's awesome.
Yes, yeah.
Because I have Christian Health Share, and they are not, but.
Gotcha. Yeah. So yeah, I mean, I have had several clients with Samaritan Ministries get it paid for their visits for the naturopathy.
As someone who's new to the whole thermography thing, what are things that I need to be aware of to know if I'm getting a good scan or not? I'm down in, I don't know, do you ever come to Texas? I'm in Fort Worth, Texas. So.
Oh yeah, we come to Texas once or twice a year.
Oh really?
Yeah.
Whereabouts?
There's a place a little bit south of Fort Worth, Mansfield maybe, or.
Yeah.
We go there, and then we also go to Carrollton.
Oh, okay.
Yeah.
Oh, cool. Cool.
Yeah.
Good to know.
Late July, we have relatives in Fort Worth as well.
Okay.
So we were just there late July, early August. We've again been there about 3 years, and I'm trying to talk my wife into going back down there again because we have a lot of ladies that did it for the first time, and they need to do a follow-up. So anyways, I don't mind the travel. So looking for an excuse to do it.
Yeah.
But as far as a scan, I mean, I went to a thermography center, actually in Dallas, that was recommended to me by a few different naturopaths in the area. But like I said, just being new to this, I really don't know a good scan from a bad scan at this point. You know,
if your images look like mine, like there's ones that look differently. So let me just go, if I can go backwards here. Get back to the, so you can get the kind of general feel for what these look like. A lot of people use the same camera and the same doctors to interpret. As long as if the images look like this, they're likely being read by the same doctors, and the doctors are the ones that, if we don't do the imaging right, they'll say you need to redo this.
Okay.
So, you know, as long as they look something like that, you're getting it from the same company.
Okay.
Right.
All right. Good to know.
So do you find, Chip, that there are radiologists that are resistant to looking at thermography scans, or are they is that becoming more mainstream for them?
They're still, I would say probably 90% of radiologists are still resistant to it.
Okay.
They would only be open if they are more like functional medicine.
Gotcha.
If they've just become open to, there's more to life than conventional wisdom. So, you know, I work with a medical doctor that has us come into her practice twice a year. She's a functional medicine doctor. She's not a radiologist, but she brings us in twice a year. Why? Because she had a patient that had multiple mammograms. She knew something was going on in one of these breasts, but they couldn't find it, and the thermogram found it. So
There you go.
Yeah. But she's very open to alternative stuff, integrative stuff.
Okay.
And those are the type of radiologists that we work with.
Yeah. Makes sense.
And to go a little further with that, Chip, the radiologists that will do this, they take further training to be like, aren't they like thermologists or something?
Yeah, they do undergo more training to make sure that they accurately interpret these thermograms.
Okay.
Right. All right. Well, I want to thank everybody for being on tonight. I'm going to go ahead and wrap this up and
Okay.
stop the recording.
Okay.